My name is Frederikke Storm. I'm a research assistant here at the Department of International Health, Immunology and Microbiology at University of Copenhagen. I have a background in public health, and then I'm also member of a Danish civil society organization called Global Doctors. I think, first of all, health issues that transcend national borders. So both disease developments and disease outbreaks, but also challenges that are relevant to all health systems and where we can learn from each other. So developing new knowledge and how we can collaborate across borders and securing access to health services. I also think there's a political dimension to global health because every solution often requires political willingness and prioritization. So for instance, if you want people to have as equal opportunities as possible in attaining healthy lives, it will often require structural adjustments in the health system design, in the public health financing, and in securing, making urban environments, for instance, safe and secure for people. So that's dependent on the political will. So there's definitely an equity and justice dimension to global health for me as an essential part. And sometimes it means that we have to push policymakers a bit, or at least keeping them very well informed. I would say keeping poverty reduction as the overall goal is important because it's such a key determinant of health. But definitely also human resources for health and health system strengthening, because it's, to me, the most sustainable investment we can make to secure that people have equal access to services. So achieving or striving towards universal health coverage is very important to global doctors in the organization, and what we're trying to support in our projects and in advocacy and in meetings with stakeholders. Climate change and how it will, understanding its effects on our health. But definitely also the rapidly increasing burden of non-communicable diseases, that is diabetes, heart disease, cancer coupled with mental illness, injury, and infectious diseases in many low and middle income countries is a huge challenge now and in the following years. Then I guess health worker shortage, as I mentioned, both within and between countries. I would prioritize human resources for health because no system can function without people. So we see constant new technologies and medical advances, but it all comes down to the people who are to implement and make it useful, and that they are qualified. So achieving universal health coverage very much depends on skilled health workers. The academic term will probably change again and again, but I have no doubt that global health as a field of practice and as a discipline will continue, and hopefully we will become better at it and more qualified as also new educational opportunities are offered. So I guess it's a field that's becoming also more professionalized and recognized as a field of its own.